Thank you so much, respected Rotarian President and Secretary and all the members who welcomed me so warmly. It's good to be back. It's a topic very close to my heart, also because this is a genuine challenge that we are facing nowadays in terms of artificial intelligence, and then we talk about mental health. So what I would like to be talking about over the next couple of minutes is how, from my practice personally, we have seen this take effect, especially in the last 2 to 3 years. I'm sure you would have heard of artificial intelligence, but then in the field of mental health, what does that really look like, right? So imagine artificial intelligence to just be a very fast, quick learning, smart, intelligent student that is learning from examples, not from a rule book that you give. It's learning from every prompt and every question that you ask, it learns. What are the kind of things that people are looking for? What do they need? And it's adapting. So it's constantly learning and it's fast, right? So that is what is artificial intelligence. So do we welcome it? Yes. Artificial intelligence can be creative in ways that I cannot be, right? I truly cannot be that fast and that rapid in terms of my problem solving. I have to acknowledge that. How I would like to introduce the concept of the challenges and transformations we are facing. So I want to take an emotion that we commonly work with in therapy. So let's say grief. Okay, so not to undermine this difficult emotion, but if you could just describe grief to me in 5 words, what could that be?
Denial.
I'm sorry?
Denial.
Denial, okay.
Despair.
Despair, sadness,
Trauma.
Anything else that comes to mind when you think of grief?
Loss.
Loss. So you hear a couple of words here which there would be a combination of something which is a general, well-known experience of our understanding of grief, which means someone who's not personally experienced this as well can talk about what it is. But there is a difference in the words some of you used. So maybe there is a difference in lived human experience of that emotion. Maybe for some of you, you think of pain, and for someone else, it's just despair. So lived human experience is different from one person to the other. Do we welcome AI in the absence of this lived human experience? The kind of challenges and transformations we are facing right now, I would like to segregate it into 3 parts, right? And as therapists, the first thing that we are facing is in terms of availability of excess of content. Massive amount of unfiltered content that is readily available for even clients to access. They have the same data that I can access. Right? So the content is very overwhelming for us therapists itself and even more for clients. Say for example, if I just type into ChatGPT, what are the say long-term effects of using clonazepam? Now this is a medical drug that is used for to treating mood-related concerns. It's a common drug that is given, right? And it's given in very mild quantities. But if that is my prompt, what is the long-term effects? ChatGPT throws up cognitive impairment in the long-term run, resurfacing of suicidal ideations, memory fog, and resurfacing of depression itself. Now imagine a client reads that. We have had a lot of difficulties in the last 2 to 3 years, especially asking clients to access medical care or psychiatric care to supplement therapy. And a lot of times that's needed. But they read and they say, no, my psychiatrist is trying to kill me. I'm not going there to get low IQ. No. And it says suicidal ideations will come back. So why should I take it? Ammunition in the hands of a skilled soldier can win us a battle. But if I give a loaded gun, and I will not, but let's say I give it to my little 2-year-old, she could set it off, she could play with it, she could exchange it for a vada, and she could find a tissue paper more interesting, and it will be useless. So that content or that ammunition can be very confusing for clients who are not self-regulated, who may not be well read, who are frustrated with their emotions and are looking for an agency to get better. Content therefore can be very overwhelming. But that being said, I do use AI to structure educational material for my clients, and it's brilliant. What makes a difference is the human touch. And there's a buffer between AI and the client. That's so important. We can't do without. The second area that we're facing difficulty with is self-diagnosis. Right? I'm sure we have done it too.
Yes.
But this is not the age-old wisdom that comes when it comes to, let's say, a fever or a cough or a cold or a food poisoning. They are self-diagnosing psychiatric illnesses. Everybody is an expert that walks into that room. Right? So they know already. And in fact, there are several times when I feel challenged by a client, almost as if they're saying, we know what we have, do you know what we have? For years, so I've been practicing for about 15 years now. And for years, we have navigated, my colleagues and I have navigated therapy where we take a call not to reveal a diagnosis to a client when we see that it does more harm than good. Just the fear of a label, the fear of just being put into a category when there's not enough information around. But now, we can see things are changing. Right? So, research says, or if we look at statistics, more than 80% of individuals between the ages of 20 to 30 go to AI for advice for their health-related concerns. So easily accessible, right? It's quicker than, and this is something that, when I talk about the medical care that's available in Bangalore, my husband and I, we have access to having a consultation within 10 minutes, anytime that we want it. And we've heard people say that, oh my God, within 10 minutes you can get a pediatrician, you can get any doctor, and that's great, but this is faster. And it's diagnosing. Right? So just recently, I had a client. Okay, so before I go into this, so let's say that you walk into a doctor's office, right, and you have food poisoning. Right? I'm sure we would have experienced food poisoning at some time in our lives. So if you go into a doctor's office and he asks you, what brings you here, what's happening, what would you tell him? Okay, I have food poisoning. And he might ask like, okay, so you have food poisoning, what is happening? So what would you tell him then?
The symptoms.
You would tell the symptoms. So what could they be?
Vomiting.
You have vomiting, maybe you have nausea, okay, your stomach is upset all the time, you're not able to digest food, you've been throwing up. You do give him the symptoms, right? Or do you just say food poisoning and then he just trusts you blindly? You do give him the symptoms. So just recently, I was called in for a screening for a concern we call as attention deficit hyperactivity disorder, ADHD. It's increasing in prevalence now with prolonged access to gadgets and all that. So I asked the client, you asked for a screening, so can you tell me what are the concerns you're experiencing? And he said, Doc, can you just give me a minute? I'm just going to pull up AI and I see what I've read, and I call out what are the things that I'm going through. I was asking him for lived experience. Tell me, if you are having some difficulty, I want to go to AI. I have read, and I want to read out to you. Now, do I trust that he actually has this concern? So, diagnosis is becoming very difficult for us, where the measures that were in place for years together is no longer adequate. We have to upgrade, we have to cross-question. So for now, something that would have been a 1 hour process, I want to talk to his grandmother if he can bring me his grandmom or his aunt and uncle and teachers and whatnot just to get more data. Because he's ready with the symptom list and he reads it to me exactly how it's worded. So that's a diagnosis met, right? And we cannot give medication based on that. The second concern related to this and self-diagnosis is also fear. Unnecessary amount of fear because they already put themselves into a category before they step into the therapy room. So we are dealing with a new emotion related to diagnosis that we have not had in a long time, and that is shame. We have not had to work with shame in a very long time, and now we have to, because they already predict doom and they walk into the room. They already are in extra despair before they walk into the room asking for help. Self-diagnosis is the second area where there is a transformation happening, but AI has been very, very helpful with giving out the early markers. We have a lot of AI tools that give us daily data about sleep cycles and a lot of other biomarkers that are very helpful for planning treatment. So AI is helpful with a human touch. And the third area, right, this is the last area that I have categorized, is progress. When you have a lot of information, you get this indirect pressure that you have to get better because you have all the information. Why are you not getting better? You have all the points. It tells you exactly what to do and the order in which you have to do it. Why are we not getting better then? So clients are faced with this or are experiencing this surface level awareness that I know all of this, then what? And they're increasingly frustrated because of the speed at which AI is able to give you information, but it's not able to get you the healing as fast. For emotions like trust, once it's broken, I can't code it back into my client. Right? Relationships, once broken, I can't just put them in a program. I can't program them to have better relationships. None of these emotions are digital or technical. And that is where we see the largest of gap. AI is learning, right? We have amazing applications. For example, there is an organization like Jayaseelan, right? The first few steps is all with AI, and it does a great job of helping the client calm down, give the history. So it has helped with documentation and the preliminary, paperwork that we used to spend a lot of time with. But with the urgency of progress is frustrating a lot of clients. Because unlike before, we are not having clear-cut disorders anymore in our field. 10 years back or more than that, someone reminded me how old I was in the field. About 15 years back, when I was an intern, we used to have a lot of clients who had something called as schizophrenia. Have you heard of that? And we used to be like, oh, please, give us one person who has depression because we have to submit a case in college. We would not find that many. It was very difficult. Right? So we used to get schizophrenia, we used to have psychosis and occasional depression. But now, What is it changes?
Every second person.
It's such a layman
So
term
joint
that's
rotary.
being used very loosely. You know, in the university where I studied, just before the assignment submission, we used to hear a whole bunch of students say, "Arey yaar, I think I'm depressed. I have this submission." It's just, no, everyone is depressed. We don't have clear disorders anymore. We are having what we call as comorbidities. We are having a batch, a bundle. I used to work with children with ADHD before, but now it's a collection of disorders. The same child is presenting with ADHD or autism and cognitive deficit and behavior regulation issues. It's a collection. It's no longer psychosis. It's psychosis with depressive symptoms. It's a bunch. So where is the human touch? What does AI do? AI gives you content. AI can aid in the diagnosis. AI can help structure in the intervention plan, but you need a human to peel that onion and get down to the layers one by one. We need that human touch when it comes to mental health. Two ways in which I have not seen AI being able to take over our field is empathy. Right? It's a beautiful emotion, and I feel one-to-one, a human can help another human heal. So just a few days back, day before yesterday, I was working with a client who was having issues with fertility. And I could see, or I could sense she felt understood just by the words that I chose to use at the right moments, or the pause that I give, or the moment of silence, or it could be that I teared up at the right time. Empathy. And then you hold that client in that safe space and then take them through. And this is something that AI has not been able to do a lot. Empathy. The second is self-disclosure. And that is also one part of what we do in therapy. We want the clients to see us not as perfect machines who are just directing them how to live life. They need to see us also as flawed. They need to see us also as limited. Only then will they connect. Only then will they trust. If I'm perfect, there's already a power imbalance in the session. Therapy is about treating them as an equal and then accepting some inputs from somebody they see as an equal. So with self-disclosure, I'm able to share parts of my journey, maybe resonating with parts of theirs. I'm able to share stories of other clients who have gone down a similar pathway or who are stuck in similar spaces. And they don't feel alone anymore. They're not chatting independently with a machine or with data. Just a couple of months back, I had a 15-year-old who came into the clinic, and the parent was talking to me about how, she really wants him to go out and play. He has used AI to code and make a friend. And he talks to that coded friend in his room every day. He has created a friend. Now tell me, is that social skills? Is that's learning? Yes, in the safety of a space that he cannot generalize. With a human touch, we hold clients in a safe space. We teach them, guide them one-to-one, and then guide them how to generalize to the world outside. Do we welcome AI? Yes. It's too late to ask that question. It's already there. It's incoming in our field, but with the human touch, clients are getting real-time validation, real-time connection, real-time space for growth. Just a quick example before we wind up. One of the biggest fears that you might hear resonating, maybe you would have experienced it yourself, the traditional "what will people say?" The fear of what will people say, the fear of being judged. Now, can you give me an idea of how AI, a machine, can help you navigate your fear of being judged versus you're sitting with someone in front of a therapist over a period of a couple of months where you learn that the world is actually not a judgmental place. Where can the experience be more real? So when clients realize after 6 or 7 months that this therapist is not judging me, I'm safe, I don't feel hurt and targeted all the time, it's a safe space, and then we ask them to trust others. It first comes with what I'm able to model inside a session. Do we welcome AI? Yes, but with caution. With stricter regulations about when we use it and how we use it, especially in a field like mental health. To guide clients not to over-rely on AI, but to come with us, to us, that's what's happening right now. We spend a lot of time re-educating clients, which was not there before. So never forget, what can really make a difference is human emotion and human presence, right? Thank you so much for being a wonderful audience.
One question.
Oh,
Does
yes.
the client set the mobile in front of you and doing that?
So because they come very well prepared. Yes, in fact, I was just sharing with my mom a couple of days back that I had a client who had all the answers. So about 5-10 minutes into the session, he said, "Doctor, I'm so sorry to stop you, but I am looking at every expression of yours to see if you are confirming my diagnosis or not." So I am under analysis, not him. He's looking at me. I don't know what I was doing, probably fiddling with my hair or something, but he was looking at me. They come prepared. A lot of the clients come prepared because even if it's not through them, through their friends and friends of friends, they know the data is available. So not during the session. They respect the space enough. But since I do a lot of online consultations, I do not know if they're doing it under the table. But they do come with data for sessions.
You use the word regulation. How do you regulate?
With AI. Interesting. So it comes from the system itself about how much data can be made available. So just something to throw it out. Let's say before, depending, yes honey. So depending on the nature of the prompt, say for example, if I ask a question, what are the long-term effects of clonazepam? Maybe I get a question which says, are you a medical practitioner? And if I say, no, I'm not a medical practitioner, there's a word of caution at least put there by saying that the data has to be interpreted with a medical professional. That is not there.
So how can we interpret that?
We cannot do anything right now.
No,
It
but
has
you-
to be.
You people can take it up through the associations.
Yes. There are a lot of changes that are also coming from our side, but right now with India, we don't have one single regulatory board for therapists themselves that is been consistent over a period of time. So only when there is a consistent board.
Is it available in the US for example?
Yes, they do have very strict boards, but they have a whole different set of concerns when it comes to mental health.
Yeah, they have.
Right, it's beyond, even before we come to AI, it's very different and challenging there in its own nature.
So the question is again,
Yes.
same thing, how do you regulate something?
Yes, because
Out there.
India, the advantage is even the human access, like therapy access, psychiatrist access is quicker, unlike abroad. So the chances of a person in Western countries going to AI for information is so much more than in India. Yes, and as Indians, we tend to follow the West because we are behind a couple of years when it comes to progressive therapy and techniques and all of that. So they always look to the West to set the guidelines, and then it comes to India. So I feel in a lot of ways, even as therapists, the smaller things we tell or we have to tell clients now is, you might go to AI, whatever data you have, please bring it to us first so that we can tell you what is good data and what is data that's just random, that is may not relate to you. For instance, just if you just type in, let's say, how long does it take to recover from depression? ChatGPT will tell you 3 to 7 months.
Well, you give you 3 to 7
It will
months.
tell you it's 3 to 7 months. You can cross check it as well.
No,
It'll tell you 3 to 7 months. Now, for a person who is seeing 7 months, by the 8th month, what they feel despair. But there are different factors involved. What ChatGPT or AI is not accounting for is individual human differences.
Exactly.
Your support systems are different. Your lifestyle is different. Whether you ate breakfast or not, that counts. Right? Whether you have enough exposure to sunlight, that counts. All of this, ChatGPT right now, AI is not taken into consideration. It's just giving you data. And it depends heavily on your prompts.
So AI is basically data driven, not intelligence driven.
It's data driven by our intelligent question and the way I prompt AI. So for a
And
while,
whatever is the history of whatever it has experienced.
yes. Those are our prompts,
Absolutely.
right? So if I ask how soon will I live, when can I start feeling better, it will give me data accordingly. Or what are the signs that I'm going to feel worse, it will give me data accordingly. And because we are not a culture that can be bored anymore. Very few of us can sit for 5 minutes anymore without just doing anything. So because of that, they are moving into a generation that is not thinking for themselves. And that is what is lacking. And that is a different way in which we can handle the AI challenge. Bring up a generation that can think for themselves, that can question something that is bundled as perfection. You question that also. But we have to bring up that generation, not the ones who blindly accept just because it's there. Thank you so much.
There are not many children in the age group of 10 to 12 or 14 who are getting addicted to the mobile phone. What would you suggest and how will we go about it?
Correct the parents. Correct the parents. Simple.
I think we all know the answer, right? Model. It begins with modeling the right behavior. Begins with modeling the behavior, and with a lot of people I'll say increase outdoor activities as much as possible. But we have to acknowledge it has to become a different balance than the one that you had and the ones that I had. I cannot think of a world. I would love to not give my child.
But the parents are giving it right from the 6 months while feeding the baby, while this thing. The parent is themselves getting used to it. They're used to it. And
So
then
just as we said with AI,
that
regulate it, and focus on content over the time that you spend. What information are they taking in during that time? If it's just content that the brain has not learned to take in, just random content, or preferably the parent has to sit with the child during that content absorption so that there is a buffering interaction, not just alone unsupervised, at least till the age of 8.
Parent will hand over the telephone because he has no time.
but there are boarding schools and all where they're not allowed to.
And they smuggle them
A lot of children are being put into those schools because of that.
in. They smuggle them in.
But they smuggle them in. Exactly.
Just imagine if there is all the students have mobile in their hands, the teacher will have a tough time.
No, but they have laptops, which is the same story.
We will hope for the best. We will change ourselves first. So I have learned what is really helpful for me also is, or for me and my partner as well, my husband, is that whenever we put a physical distance between the mobile and us, we get to spend more time with her, then that has caused a lot of differences because she likes other activities than this. We have to go without a lot of things, missing out client appointments, double bookings, lot of things, right? So it has been challenging, but it has been helpful. Putting a physical distance for us. My phone is forever on silent. I think my parents can vouch for that, so I'm using it myself half the time, but it's helped.
Okay.
Thank you.
Thank you.